Hello, good morning everyone. Hopefully you are doing fine in this morning. During COVID-19 situation, this must be very hard for us to fight and to survive for this COVID situation. But in this, we have to stay safe, stay fit, and stay on this stand during this COVID situation. I'm Husnan. Welcome to our news. And for our top headline today, COVID-19 is a substantial international public health issue. As of January 18, 2021, an estimated about 95 million people worldwide had been infected with the virus, with about 2 million deaths. As a consequence of the pandemic, social media is becoming the platform of choice for public opinions, perceptions, and attitudes toward various events or public health policies regarding COVID-19. In the face of COVID-19, social media is also one of important role during the pandemic for individuals and communities to stay connected, even while physically separated. This COVID situation has received close attention from governments, researchers, and the public in various countries. Social media can also be effectively used to communicate health information to the general public during a pandemic. In order to be effective, especially during a crisis, public health communicators have to be seen as credible, transparent, and trustworthy. The pandemic has consumed the world combined with the volume of communication, content, and data generated on a daily basis can present several problems to the healthcare professional who uses social media. Also in this case, billions of people are eager to get information about the COVID-19 through social media. More than 2.9 billion people are using social media regularly. Even the social media haven't amazing spread speed, coverage, and penetration rate. Let's take a look at how individuals, businesses, and government agencies have been sharing information and interacting with others in social media in a few past weeks. A source of information and misinformation is a primary role that social platforms are playing during the COVID outbreak. The COVID-19 pandemic has been plagued by the pervasive spread of large number of rumors and conspiracy theories which even led to dramatic real-world consequences. From the perspective of content recipients, healthcare professionals can misinterpret media that they have read if they do not pay attention to the final detail or critically appraise the material. Implementing information out of context can also be harmful, especially if the practice spread, further perpetuating the initial mistake. The use of social media in medical education and healthcare prior to the COVID-19 situation has been controversial, despite the number of healthcare professionals and organizations who engage on social media platforms continually increasing in recent years. There remains significant debate as to the merit of social media in terms of actual learning and improvement in the quality of care provided. The World Health Organization or WHO has found that the outbreak of COVID-19 and also the response measures are accompanied by abundant information, and it is difficult to find reliable sources and reliable guidance. These inaccurate and often sensationally soundbites are frequently picked up and reported by mainstream media, causing unnecessary distress to patients, their families, and of course the healthcare professionals whose working relationship with their patients are founded on trust. For rumors and false information that spread on social media, it is necessary to coordinate the search for sources, identify, and reduce their spread. The actions of government agencies and social giants have shown that public-private cooperation to identify, fact-check, and even delete false or outdated information may be an effective way to prevent this online information from hindering or even worsening public health efforts. Social media operators can monitor high-traffic information and combine artificial intelligence to remove misleading information in a timely manner. The current focus of COVID outbreak and its rapid transmission of information in the world has made people learn and aware of the importance to access and keep updates as well as to follow its subjective guidelines. During these pandemic days where people are restricted to their home and families are bound to follow the social distancing and precautions for physical interactions. In the meantime, the usage of social media platforms are perceived as useful for sharing information, learning, increase awareness, and stay connected with the rest of the world. As we know, people are working from home and enduring the social distance. Thus, the majority of the regular time have been used up by spending more time on social media platforms not only to stay connected and receive and give social support to their relatives, colleagues, and friends who cannot be visited due to the physical distance restriction. But also for socio-psychological healing, sharing public information about the virus and illness, and suggestions regarding risk communication search from various information available around the world. As misinformation social media, it becomes apparent that the pandemic is just one of many battles against misinformation to be fought. That is our top news for today. We have to put our mask on when we are out, follow the rules, and keep updated about COVID information on social media or on TV news.